Are you or someone you know experiencing a range of emotions when considering whether to pursue an autism evaluation for your child? While awareness of autism has increased, hesitation to seek assessment or services remains common. Hi, my name is Jacob Lee. I'm a board certified behavior analyst. I'm also the CEO of Aspire Behavioral Services in Las Vegas, which is a part of the Teachers Health Trust Health Investment Network. Parents and caregivers may delay or avoid seeking an autism evaluation for several reasons. Families may worry that a diagnosis will define their child or limit future opportunities. There is often concerns that labels may lead to stigma or altered expectations. Another reason is the possibility that a diagnosis can bring feelings of grief, uncertainty, or a shift in expectations. These emotions can coexist with deep love and commitment to the child. Many families may also hope that developmental differences will resolve over time. This perspective is often reinforced by well meaning friends, family members, or community messaging. Some parents may worry about being blamed or judged for their child's development, which can create barriers to seeking support. It's also understandable that navigating evaluations, eligibility, insurance, and services can feel overwhelming. Uncertainty about where to start or what to expect can delay action. There are also some families that have concerns about therapy approaches, including outdated perceptions of autism services, including applied behavioral analysis. There may be fear that interventions will attempt to change the child rather than support them. To help families feel supported, respected, and empowered to explore next steps, Aspire Behavioral Services is committed to reducing these barriers. We acknowledge that it is natural for families to have questions or hesitations. Curiosity and exploration are encouraged as part of the process. Our team approaches families as partners. We do not position ourselves as decision makers, but as guides who collaborate with caregivers to determine what is best for their child. Services are designed to be individualized, developmentally appropriate, and respectful of each child's communication, preferences, and identity. We emphasize connection, engagement, and meaningful progress. Particularly within early intervention, services are delivered in natural environments such as the home and community. This approach supports learning within the context of everyday routines and empowers caregivers through coaching and education. We provide clear, accessible information about what an evaluation involves, who participates in the process, and what outcomes families can expect. This reduces uncertainty and builds confidence in decision making. We also create space for families to experience a range of emotions without pressure or judgment. Families are supported whether they are ready to move forward immediately or need time to process. Additionally, we emphasize that a diagnosis does not define a child's identity or potential. Instead, it provides insight into how a child experiences the world, creates access to appropriate support and services, and equips families with tools to advocate effectively. Seeking an autism evaluation is a significant step for families. Our role is to not push families towards a decision, but to ensure they feel safe, informed, and supported exploring their options. We believe that families should never feel judged for where they are in the process. Support begins with trust and understanding, and early engagement is most effective when it is guided by partnership and compassion. By creating safe, welcoming pathways to care, we can reduce barriers and ensure that families access the support that they need when they are ready. Thanks for listening, and if you would like to learn more, check out the information in the description below on how to reach out.